In terms of funding, we're very familiar with how much we're funding right now. But I think Senator Po was able to help in increasing the cash assistance fund to something like, I think, a billion. There was a time it's ₱1 billion pesos. But in terms of gaps now, I think the problem would be, and it's being addressed now by the enactment of the Regional Specialty Centers Act. We will now build specialty centers in the regions, in the other provinces. If some of you are familiar with the Philippine Health Facility Development Plan, there is the plan to give access to specialty centers in other areas. We made a law on that in order to ensure that there is funding. Because if you do not have a law, sometimes ang hirap umabot sa DBM. Yun ang problema natin sa DBM. Sabihin lagi ng DBM sa amin, sabihin lang, complain sa amin lagi. We can't get funding from DBM. Why? What's the reason? Wala naman kayong batas eh. That's usually the problem with DBM. But in case of, we were discussing with Dr. Erwin a while ago yung vaccines. Bakit yung vaccine? Wala namang batas. And that's what CPA would be needed. Sometimes they're catalytic. When they introduce the program and it's absorbed by government, sometimes the government may katras. Even the gobyerno, that's why people are already expecting that government will provide that because of some project of some NGOs before. So that's the dynamic in government. So sometimes you have to know how to make use of a law, or sometimes you just know how to make use of the efforts of the NGOs, the other, like what you're doing. You pressure government to do this, to do that.